So a warm welcome to those of you that have already joined us for our session today. Please choose the language you would like to hear the session in. I think you probably all know by now that you have the translation button at the bottom of your screen. It is an image of the globe, and you can select between English, Spanish, French, Russian, and Arabic. So please feel free to choose the language of your choice that you would like to hear the meeting in. So a warm welcome. We're just going to give it a few minutes for all our participants to join, but it is wonderful to have you with us today for our session on protecting, promoting, and supporting breastfeeding. For those of you that have just joined, welcome. Please choose the language you would like to hear our meeting in. You will see an option at the bottom of your screen with the sign of a globe for translation. You can then select which language you would like to hear from English, Spanish, French, Russian, or Arabic. If I can ask for everyone to make sure that they have their cameras turned off, please turn your cameras off and please make sure that you are muted. So, as we begin, it is our joy to have you here on the second of 8 sessions that are taking place in the Health Talk series as we prepare for the Nutrition for Growth Summit. UNICEF and WHO are hosting this week-long series of webinars that focus on improving nutrition through a multi-system approach. And the events will highlight key priorities and actions that countries are taking or are planning to take to deliver essential nutrition actions in the health system. If you need technical support, you will see that you can approach our technical support directly in the chat box by looking for One Tech Support. And you will send a direct message then to our technical support. You are most welcome. And in order to know who's joining us, we would like to ask you to please say hello in the chat box. So in the chat box, please feel free to say hello. Jürgen, we have a few people in the chat box that are asking to be assigned as interpreters.
Yep,
so
I'm doing it
now.
You're
looking at them.
Yeah.
Over to you, Jürgen.
Yeah, I will add them now.
Thank you very much. And lovely to see everyone saying hello. And it's great to have colleagues and friends from around the world with us today. I'm going to remind you that we also have a Q&A box, and the Q&A box is the only place that you are to please write questions. Any questions to our panelists, please enter in the Q&A box. We do not have a Q&A session specifically in this session, but I will ask you that you put your question in the Q&A box, and our presenters are going to try after their presentations or after their panel discussion to try and answer your questions directly in the Q&A box. But we do apologize upfront if we don't get to every one of your questions. But it's great to have you with us, and each one of you is an important member of this session. You will see that our recordings will also be available, and will be shared with you, as you will be able to see on the link. We are also going to be using Mentimeter. So I ask you also to please, if you are available to have your Mentimeter, there'll be a link in the chat box when we come to that. So let's get started on our session. I'm reminding you that it is being recorded, so you give your permission for it to be recorded. If you don't give permission to be part of the recording, we just need you then to leave the meeting. We today are going to showcase countries' best practice. We're going to focus on high impact interventions, and we're going to share with you resources that countries can use as you prepare for the Nutrition for Growth Summit. But let's start with the most important voices of all when we talk about protecting, promoting, and supporting breastfeeding. Let's hear from mothers. So over to the mothers of the world to share with us their thoughts on the importance of breastfeeding.
We can give our baby good nutrition for their health.
It's been such a positive experience to be able to feed my child and comfort her and tune into her needs. I have just felt, so connected with her.
Reduced stress, increased health, a multitude of benefits. It made a huge difference to my baby's sleep and my ability to settle my baby.
My baby boy is now 11 months old, and I intentionally refrained from giving him formula. He enjoys breastfeeding and eating local foods. That's why you see him strong and healthy.
لأنه رضاعة منيحة للولد وللأم الاثنين منيحة بنفس الوقت. والجاي بقى أهم شيء.
The one word that describes breastfeeding is immunity.
What breastfeeding means to me is caring.
And if there's one word to describe breastfeeding, I think it's love.
Breastfeeding was not an easy road for me. They say it takes a village to raise a child, and that couldn't be more true.
When I became pregnant, I received lots of samples for formula saying that it was a healthy substitute for breast milk and that it would be much easier on me.
When you go to the supermarket, when you watch TV, advertisement for baby formulas everywhere, and they're promoting that, oh, your children will be smarter.
So my experience at the hospital was not so good. I was asked to introduce formula.
Cuando mi hijo nació, el personal de salud se lo llevó a otro lugar y le proporcionaron allí un biberón de leche de fórmula.
The pediatrician said to me, "Too bad, madam. We will be forced to give her formula, breast formula." And he showed me a free package.
It is hard for me to breastfeed her because I didn't get enough support.
My baby did not put on weight, and I didn't receive very good breastfeeding support. It was very, very difficult.
My profession at the time as a journalist, I spent most of my days on the road, so it's hard to breast pump.
Health facility did not have samples of formula. Immediately after, a counselor supported me to initiate breastfeeding and encouraged me to continuously and exclusively breastfeed my baby.
My daughter was born in a baby-friendly hospital. I feel a great support in my breastfeeding journey.
Often people say it's something natural, but support for breastfeeding actually means a lot.
I had amazing support from groups, 24-hour access to voluntary support, and it was incredible.
Amazing moms who have helped me through it. I'm still exclusively breastfeeding and I'm so happy about it.
I had postpartum, and then it was counseling that really helped me to push through with breastfeeding.
Resources in the community to help figure out why my baby still wasn't gaining weight.
A lactation consultant actually taught my baby and I to establish successful breastfeeding. From that moment on, I managed to successfully breastfeed.
My lactation consultant, he helped me fall in love with breastfeeding, and I'm pregnant with my 4th baby and I plan on breastfeeding this baby too.
Breastfeeding counseling is important, especially for a new mom, because it actually increases our confidence and our ability to breastfeed successfully.
D'avoir un conseil sur l'allaitement, ça m'a sauvée du désespoir et de l'isolement de la jeune mère, sauvée aussi dans ma confiance en moi, dans ma relation avec mon bébé. Et ça a eu des conséquences sur toute ma capacité à être mère.
The fact that I'm still breastfeeding and my baby's still getting the immunities that my milk provides, especially during the pandemic, brings me joy.
And my village helped me with finally being able to exclusively breastfeed.
That really is inspiring, because given the right support, really we could see how mothers could overcome many of the barriers. Protecting, promoting, and supporting breastfeeding needs to be one of the key commitments as we head into the Nutrition for Growth Summit. So let's start off by immediately putting up a Mentimeter for you. The link is going to be put in the chat box. And I see we already have one answer to this one. And I think that was just a test run, so don't worry about it. You will see that you can open Mentimeter. Let's see if the link also gets put in the chat box. But otherwise, please open Mentimeter. There you are. You'll see the links in the chat box. Click on the link, and then you will see the code on the top of the slide. And I see some of you have already, someone's already in the link. And the question is, how far is your country in the process of making a breastfeeding related commitment? And you have the answers that you can choose from. They are still learning about the process. They're considering a pledge this year. They are making a pledge this year, or you don't know. So I see we have a number of the answers, people joining, and putting in their answers. I'm not going to give you too much longer. So let's see how quickly all of you can enter in. And the link is in the chat box. So you will see in the chat box, the link is there for you in all the languages. And let's see how many people are able to enter in. So if you can't see the link in the chat box, you literally go to Mentimeter. You'll see on the slide the link to Mentimeter. You click on the menti.com. You can go to Mentimeter and enter the code. You will see the link at the top of the slide or in the chat box. We will check the chat box. I'm sorry that the link was put in the hosts and panelists in the chat box. It was not put in the everybody link. So apologies. It's now there. It's still been put in the wrong place on the chat box. I'll make sure for the next one it is corrected. So you put it in the link, and let's see. We'll see if the next one will, there's a few of them coming, so we'll make sure that it goes to everyone. And we will stop for now on this one. And we can clearly see here that many of us don't actually know whether our country is going to be making a pledge towards breastfeeding, promotion, protection, and support. So for those of us that don't know, we have a job ahead of us before Nutrition for Growth, and that is to put some pressure on find out who's deciding on our country commitments, and to really make them happen. So to help you do that, we can go to our next presenters who are going to share with you some of the 9 smart breastfeeding pledges that you could be advocating, lobbying, encouraging at the country level. So let me introduce you to our 2 presenters. Firstly, it is Miski Abdi. Miski is the Nutrition Policy and Advocacy Advisor at Save the Children in the UK, a wonderful friend of breastfeeding over many years, both Miski as a person and Save the Children as an organization. And then our other presenter is Marza Getachow, who is the Global Policy and Advocacy Manager at 1,000 Days. And I think you all know that with 1,000 days, their focus is on those first 1,000 days of life. So Miski and Marza, wonderful to have you with us. And the floor is now yours.
Thank you, Jane. Can I get the next slide? Brilliant. Malnutrition in all its forms is a global emergency affecting more than 1 in 3 people. Yet no country is currently on track to meet the 2025 World Health Assembly nutrition targets. With only 4 years left, urgent action is needed now. The Nutrition for Growth Summit, hosted by the government of Japan, will be taking place on the 7th to the 8th of December. It is an opportunity to galvanize greater global action towards ending malnutrition once and for all. Breastfeeding is central to these efforts and must be included as such. Next slide. The government of Japan has been explicit in its call to governments to put forward smart commitments that are specific, measurable, achievable, relevant, and time-bound. To help governments rise to this challenge, the Global Breastfeeding Collective have identified 9 smart breastfeeding commitments. Under the categories political and governance, we urge countries to ensure the protection, promotion, and support of exclusive breastfeeding and continued breastfeeding. Why? Breastfeeding provides babies with essential nutrients. It protects them and provides them with the essentials, vitamins, and antibodies for their survival, for their health, and their growth and development. And most critically of all, breastfeeding is a baby's first vaccine, offering protection against pneumonia and diarrhea, now the first and second biggest killers of children. If all mothers were supported to breastfeed, nearly 50% of diarrhea episodes and 1/3 of respiratory infections would be avoided. To put it simply, breast milk is a powerful and natural antidote to both hunger and disease. Under policy commitment, we call on governments to enact, monitor, and enforce legislations covering all the provisions of the International Code of Marketing of Breast Milk Substitutes and subsequent World Health resolutions. The infant formula is growing at 8 times the pace of the global population. There is more formula than there are children to consume it. The industry's aggressive marketing undermines breastfeeding and endangers the lives of mothers and children everywhere. Governments must counter this and ensure that the information provided to mothers and caregivers on infant feeding is evidence-based, impartial, and free from commercial interest. A 2016 study conducted by Access to Nutrition Foundation found that advertising of breast milk substitutes in the Greater Mumbai area was virtually non-existent. This was due to the government's tough enforcement of their code legislation. And as a result, India has a higher breastfeeding rate than the global average. Additionally, under policy commitments, we call on governments to enact legislations providing at least 18 weeks paid maternity leave. One of the most common reasons for why a woman stops breastfeeding is her return to work and unsupportive job conditions. Maternity leave is critical to enable women to continue exclusive breastfeeding and continued breastfeeding. It can also reduce infant mortality. Recognizing these benefits, this last year, the government of Bangladesh pledged to implement a 6 months paid maternity leave policy for all sectors, including the informal, as part of their Tokyo Nutrition for Growth commitment. Next. Finally, for financial commitments, we call on governments to increase funding to improve breastfeeding rates. Breastfeeding is a smart investment in people and in economies. The numbers speak for themselves. Every $1 invested in breastfeeding yields a return of $35. Increasing breastfeeding worldwide could prevent 823,000 child deaths every year, generating a global savings of $300 billion by enhancing human capacity, increasing intelligence, and boosting adult earning potential. The World Bank estimates that an investment as little as $4.70 per newborn is all that's needed to reach the World Health Assembly nutrition target of 50% exclusive breastfeeding by 2025. Next.
Thanks, Ms. Kate. So the next set of commitment areas cover operational commitments. As we heard earlier from mothers, support is necessary to ensure that women can successfully meet their breastfeeding goals. And this includes providing quality counseling on infant and young child feeding by skilled healthcare practitioners, and of course, ensuring a minimum of 6 antenatal, perinatal, and postpartum contact points between practitioner and mother. Investments in breastfeeding counseling is critical to improving breastfeeding rates, boosting human capital, and strengthening economies around the world. However, we need up-to-date information, and mothers also need ongoing skilled support to support their empowerment to make informed decisions about how to feed their children, and while also ensuring their ability to navigate new complexities and realities created by the COVID-19 pandemic. To improve national progress, we call on governments to strengthen healthcare workforce knowledge, skills, and competencies in breastfeeding counseling, as well as to incorporate breastfeeding counseling within health system protocols, policies, norms, and practices. Similarly, you might have heard earlier about the baby-friendly hospital initiative. As part of this initiative is the 10 steps to successful breastfeeding. We call on governments to integrate the 10 steps to successful breastfeeding as the standard of care across all maternity care facilities, including providing breast milk for newborns that are sick and/or vulnerable. Facilities that provide maternity and newborn services have a unique and invaluable role in providing new mothers and babies with timely and appropriate support and engagement to breastfeed, saving lives while also saving governments money. A systematic review from 2016 across 58 studies from 19 countries concluded that when maternity facilities follow the 10 steps, it leads to increased breastfeeding rates. And this is across any breastfeeding. So early initiation immediately after birth, exclusive breastfeeding, and continued breastfeeding through 2 years of age. The review also found that the likelihood of breastfeeding is higher when mothers and newborns are exposed to more of the 10 steps. Next, for operational commitments. Oh, sorry, can you please go back a slide? That was confusing. We are calling on governments to provide community programs that support women to initiate and maintain breastfeeding. I'm sure we all know here today that community healthcare workers represent an important resource in helping to bridge the gap between healthcare providers and vulnerable populations. So we must ensure that they're equipped with breastfeeding counseling and competencies to establish and integrate breastfeeding support within existing community structures to sustainably link health facilities to hard-to-reach communities. For monitoring, reporting, and research commitments, we are calling to monitor, track, and report on the progress of policies, programs, and fundings towards achieving national and global breastfeeding targets. This includes tracking financial disbursements, but it also includes tracking infant and young child feeding and emergency preparedness response policies and plans. It's critical to train breastfeeding counselors as part of emergency response preparedness programs. And this includes ensuring that donations of breast milk substitutes, commercial complementary foods, and related products should be avoided and never included in relief distribution efforts. Next, please. Lastly, governments should include infant and young child feeding in emergency policies and preparedness plans. Protection and support of infants in emergencies involves actively protecting and supporting breastfeeding and ensuring that non-breastfed babies are fed in the safest way possible. So lastly, we are calling for breastfeeding as a game changer solution in ending malnutrition, building healthier and more sustainable communities and equitable food systems. Breastfeeding boosts human capital and strengthens economies around the world. The upcoming Tokyo N4G Summit can be a landmark moment for governments to improve nutrition through scaling up breastfeeding, but political action and leadership is required. We urge you to invest in nutrition now, to invest in the lives of the youngest citizen, to protect, promote, and support breastfeeding by including any of the 9 smart breastfeeding asks we went through today as part of your N4G commitments. And we have some helpful links that should be included in the chat for you to take a look.
They are in the chat box. Thank you. And everybody, you can go and look in the chat box. Make sure you click on those links to see where you can really help and what you can push within your government. Because as our speakers from Save the Children and First 1,000 Days said, the N4G is an opportunity for us to really harness the power of breastfeeding. It's central to everything that the Nutrition for Growth Summit stands for. And as one of our participants put in the chat box, it is the first food system. So if we're going to transform food systems, we have to start with that first food system in protecting, promoting, and supporting breastfeeding. So Miski and Maza, thank you so much. Let's get to another Mentimeter. And we're going to see that you've got the same code again. Those links are now right there for all of you. You can see them in the chat box. We don't have long for this one. So let's see how quickly people can start putting in something on what impact do you see or hope to see from a smart breastfeeding commitment in your country. What is the impact that you hope to see if your country puts a smart breastfeeding commitment forward at the N4G? And I see we've had our first person start us off, so thank you. Funding, really important. Ending that promotion of breast milk substitutes, critical. Baby-friendly hospital initiative be more widely adopted. Reducing disease rates, aren't these fabulous? Increasing exclusive breastfeeding rate. Real political commitment. And I see lots of exclusive breastfeeding, the baby-friendly hospital initiative, compliance with the code, putting the code in place, reducing infant and young child morbidity and mortality. Funding, also really important. Community-based support. We've got lots of lovely things happening in the Mentimeter. So thank you to all of you for putting them in there. We're also seeing a few comments in the chat box. That's also fine to put them in there. And I think that's exactly what we want to see from the commitments that we really hope governments are going to make. So because we're talking about commitments and we're talking about government actions and activities, let's move on to the next part of our session, where it's a pleasure to get colleagues from 4 countries spread around the world who are going to join me for a panel discussion. So here you see on the screen, we're going to welcome Veronica Kirongo from Kenya, Dr. Kamseng Pilavong from Lao PDR, Marshall Turner-Pitt from Jamaica, and Milika Dukic from Montenegro. And I see that the cameras of our speakers are coming, our panelists are coming on. So we'll stop the slides and we'll get our panelists on the screen with me so that we can begin our discussion, because all of us always want to know of country experiences and what countries are doing. So it is a great pleasure to have you with us. And I'm hoping that I will get to see Dr. Kamseng as well, and that our technical people might put us all together in the spotlight. Let's see how that will work. So I can see you there, Veronica, from Kenya. Let me start with a question to you. Veronica, I know that Kenya did a fabulous job in enacting the International Code of Marketing of Breast Milk Substitutes. We've heard from our Mentimeter how important political commitment was. Why was it necessary for Kenya to enact this code? Let's hear from you, Veronica.
Thank you very much, and good afternoon, good evening. For Kenya, we actually enacted the code in 2012, and actually Kenya was the first government to sign to the World Health Assembly commitment on the code in 1981. So it took from 1981 to 2012 to have the code. And why it was important is because the levels of child stunting in Kenya were actually very high, above 30, when you look at from 1998 all the way to 2009. And therefore, we needed to have a policy instrument that promote breastfeeding. And also when we looked at the drivers of mortality and morbidity in Kenya, suboptimal breastfeeding was one of them, and child undernutrition. And therefore, as a country, we felt that we need to protect and promote breastfeeding so that mothers can breastfeed successfully without any due influence. And we have seen quite some impact, because in 2014, when we held the demographic and health survey, we realized that the level of exclusive breastfeeding rose from 32% in 2009 to 61% in 2014. And our aim is to have universal exclusive breastfeeding. So there's a lot of work to be done in terms of enforcement of our Breast Milk Substitutes Act and other acts like the Health Act, which provides for lactation spaces. Employers are supposed to provide those lactation spaces. We also have the Employment Act providing for 90 days paid maternity leave and 2 weeks paternity leave, just to support the mothers to breastfeed. And for us, I think it's an experience, and we are now enhancing enforcement.
And I'm going to come back to that one. So let me come back to you on that one. I'm hoping that Marcella is on, because I don't see her camera on, and I'm hoping that also all our colleagues, there you are, now I see you, because I'm coming to you. Because I asked Kenya and I asked Veronica about their need to enact the code. But Marcella, I want to ask you, in Jamaica, what necessitated the creation of the National Infant and Young Child Feeding Policy? Because obviously there was some problem there that this policy needed to address. So we've seen the code in Kenya, and now here, let's hear about Jamaica and your National Infant and Young Child Policy. Why did that come about?
Okay, thank you so much. In Jamaica, we have a number of issues related to infant and young child feeding, one of which is inappropriate feeding practices. And this can be seen across different levels in the communities, at the health institutions. Okay, this has resulted in a double burden of malnutrition. So we have undernutrition or deficiency in micronutrients, and this has resulted in iron deficiency anemia. We also have seen rising rates of overweight and obesity, and this has led to, and these are risk factors for chronic diseases. Now, in Jamaica, approximately 82% of mothers initiate breastfeeding in the first day, and that is good. However, by the baby is 6 months old, there is a significant decrease in exclusive breastfeeding rates, and that is at 24%. Also, we have early introductions of other foods, for example, milk, formula, water, teas, and porridges. And about 1/3 of our children, as it relates to complementary feeding, are adequately fed. So the other 2/3, they are not adequately fed. And this is as a result of cultural and social beliefs and myths. For example, some persons believe that it is necessary to give the baby tea to clear the baby's stomach, or some persons may believe that 6 months exclusive breastfeeding is too long, and breast milk alone is not adequate. And this is seen in the general public and also with healthcare workers. So most of the issues are related to inappropriate feeding practices.
So this policy was really put in place to try and address those practices where it started off right with the breastfeeding, and then it very quickly went wrong. And this policy really is in place to try and address that and make sure it's strong. So I'm going to come back to you just now, but I'm going to go to Dr. Kamseng from our colleague from Laos PDR. Dr. Kamseng, I hope I can see you there. I just don't see your camera yet, but I hope you might be. There you are. Now I see your camera. Lovely to have you. Dr. Kamseng, we just heard about code implementation in Kenya, and we heard how they have enacted the code. But we know that code implementation has a very low priority amongst policymakers. Can you share with us how in Lao PDR you were able to use certain arguments to bring others on board? Over to you, Dr. Kamseng.
Yeah, thank you, Chen, for the question. In case of Laos, it was not so much any specific agreement. That was instrumental in the process, but more who we present them to. As the effective implementation of the BMS code will necessitate action, and not only from the Ministry of Health, but also from other line ministry. Yeah. And the department and just the Food and Drug Administration, the Department of Health personnel, because the Department of Health personnel, they control the health personnel, especially the healthcare provider in the hospital, no? And then the Ministry of Commerce and Industry, and the Ministry of Information, Culture and Tourism, because for the Ministry of Information, Culture and Tourism, they play the important role of control of the advertisement. And then we have also to monitor and to report the violation, impose the fine and cancel or revoke the violator business license. Among other things, then we need to convince quite a number of stakeholders. Yeah. And then we managed to do this through, firstly, convincing the leadership of the Ministry of Health, firstly, the Director General of the department, and then the Vice Minister of Health, of the importance of this legislation. Then the Vice Minister, as well as the co-chair of the development partner for nutrition, especially the EU ambassador to Laopedia and the UNICEF representative to Laopedia, managed to convince the Deputy Prime Minister, the country, His Excellency Mr. Sonsai Siphandorn, who chaired the National Nutrition Committee. The fact that the Deputy Prime Minister championed the issue and brought it to the key national dialogue with the Vice Minister on the key ministry lines was wholly instrumental in obtaining the buy-in of policymakers from across ministry.
I'm going to come back to you just now for the next part of your journey, because I want to interrupt you now because I want to go to our colleague, Milika, with her lovely breastfeeding background from Montenegro, because we've heard now how important having these policies is, how many stakeholders we have to convince to make this happen. But what is really exciting is I believe Montenegro is going to bring a policy commitment to the Nutrition for Growth Summit. So you've done an amazing job in convincing these stakeholders, not only at a national level, but to go to the global platform and speak about it. Milika, tell us about that.
Hello, everybody. Good afternoon. I'm glad to be here. And I will tell you something about our achievement. UNICEF and Ministry of Health in Montenegro did the training for the trainers from the 22 September till 25. And we achieved to educate most of the nurses, gynecologists, and pediatricians who were involved in the first hours of the newborn baby, with the newborn babies. So the UNICEF helped us, and we are achieved that they are all trained. We did that, and we did that. That we will do in November or December. We will educate the primary health care, the pediatrician with the newborn child, and nurses who will proceed breastfeeding in the primary health care. And we arranged the commitment for the breastfeeding, and it is from Ministry of Health and from UNICEF. And we will follow how is breastfeeding progress. So we will do that, and we will do also in cooperation with UNICEF. Ministry of Health in Montenegro will do the fast assessment of the maternity in the Montenegro. There is 8 maternity wards in Montenegro, and we have approximately about 7,000 delivery or newborn babies in the Montenegro. We will do that during the end of this year. So that is what we plan to do.
Wonderful. Thank you, Milika. It's so exciting to see, and to see those real commitments being made. Marcella, I'm going to come back to you for a moment, and then I'm going to, I think after that, I'll be also heading back to Kenya. I really want to ask you, you put this policy in place, and now you're obviously hoping that it will accomplish wonderful things in improving child feeding and nutrition. Talk us a little bit around what the outcomes or the impact beyond even health outcomes that you expect to see from this policy in Jamaica.
Okay, thanks. So the policy is expected to contribute to the achievement of a healthy and stable population, and that is in keeping with the Vision 2030 for Jamaica's National Development Plan. We also expect to see improvements in infant feeding practices, such as reduction in, which will lead to reduction in infant morbidity and mortality and better child health outcomes. In addition, we expect to see reduction in the burden on the health system and also reduction in household spending on treating childhood illnesses. We also expect to see improved educational outcomes, strengthened institutional arrangements, and enhanced multi-sectoral collaboration.
It's amazing, and it's wonderful to see that your ambitions are big, that this is really part of a bigger development plan with many cross-cutting benefits beyond just health. So really, really, again, it's going to be lovely to watch and to really see. And I'll probably come back to you again, Marcella. But Veronica, let me come to you again now, is that you've talked about the need to enact this regulation, the code, you enacted it, but we know that when you come to enacting the code, challenges are really big. And so for countries that are going to go forward with saying they want to set their commitment as enacting the code, share with them honestly, because I know you always are honest, Veronica, some of the challenges that you faced in Kenya.
Thank you very much, Jen. Of course, the issue of legal writing, it takes a long process. I said this journey we started in 1983, and it was only enacted in 2012. So the intrigues, of course, we have the industry who actually were, giving now the counter front for this regulation. And therefore this requires, calling them on the table. And what we found very important is to have the evidence and facts. Why are you putting this regulation or this policy? So that as they counter again on the trade lens, you also now bring the public health lens in terms of the benefit of breastfeeding. And that seemed also to work, when you say we are losing so many children because of lack of breastfeeding, we are having health costs rising. So that gives a sense, and it makes even the legislators who maybe are siding with the industry are able to see actually that public, the public health lens. The other one we also found is that the issue of having a very good legal drafter, because there's a way that the bill can be drafted and it will not be, it will be a toothless piece of legislation. So you require honest and very experienced legal drafter, which is a journey we took with the Office of the Attorney General. UNICEF and WHO are also able to support us with our legal drafting expertise. And of course, the money, you need funds, because when you are talking about advocacy, you take several groups to meetings, you require money, and of course, that require a budget to go with that. Because you can't do that on an empty plate. And of course, the other maybe major challenge that we have found is from the health professional bodies. Yeah, because at times they are influenced by the industry. And these are people you expect to understand why you are doing this legislation. Therefore, that one, you really have to be on the lookout which health body, professional body is being influenced, and get them on board, and at times use the administrative processes or the ministry to hammer the professional bodies.
So you have clearly made it very, very clear to all of us. But one thing you haven't mentioned is that you need to also have a champion for this, someone with the stamina and the energy to keep moving it forward. And Veronica, I know you and your team are those champions, and you're too humble to say it. But absolutely, I will come back to you, I'm sure. But evidence, facts, a good legal drafter, support from UNICEF and WHO, funding, and being able to convince the health professional bodies. Dr. Kam Singh, I'm going to come to you again and ask you to share with us some of the challenges you faced in Lao PDR when you were trying to get these national regulations drafted and into legislation. What were the difficulties you faced?
Yeah, thanks for the question. So we have some challenges similar like our colleague. So firstly, as known as there were multiple stakeholders and partners with different background, rational opinion, and understanding of the importance of just registration, including the technical detail of the code. So it was very necessary to bring them on together. However, with the strong position was taken that no private sector interest group could participate. Yeah. That is our strong position. And remember that this sometimes high as a foundation and association or expert group in infant feeding. That can misleading or make us misunderstanding. No? And second, there's having this number of stakeholders engaged, however, mean that even quite simple technical point, but often need the discussion with length. Yeah, that is also we have to consider. And here is really have to look at the legislation of the another country and their experience. No? For example, when the Ministry of Justice suggests that a penalty could be decided later in a separate document. And we said that when we look at the legislation from other country and the reference of registration from other country have to back up the argument as to why it should be formulated from the very beginning. And the third one for the challenges is the vast number of meetings. Yeah. But it is very necessary, to obtain the consensus of the legislation across all stakeholders. And this was overcome by the establishment of the task force with individuals assigned to participate, so that's the same representative would participate from meeting to meeting. And same like our colleague, there's a financial support as well as technical support from the government as well as from our development partner is very helpful.
I'm going to stop you there and I'm going to come back, but I think you've added some great other points. Many, many meetings and the need to really engage stakeholders, but really importantly is not to have private sector actively engaged in the discussions. So I think those are all really great points. Milika, I saw you knew I was coming to you. You felt my energy wave heading towards you. Melika, you know, you've heard this from the other countries with some of the difficulties they've faced. I also want to talk to you then a little bit about what you think other governments can learn from the experiences that you've had in Montenegro. I think some of us, when we hear, we think you're a fairly small country, you can do a lot of these things well. But if you had to advise other countries, give us some of your tips and hints.
Hello again. I want to say that it's very important to have enthusiasm, to have a will to change something, and you will do that very fast. I must say that I already said that we have 8 maternity ward in Montenegro, and we have only approximately about 7,000 delivery. So it's not difficult to change all that. That is our achievement. We are a small country, so I cannot tell to bigger one how to do something fast to be better. But we will during next year. We will. Our goal is to be a baby-friendly hospital with all 10 steps. And we will do that. I hope so. And during our steps today, we will achieve that. I sincerely hope that it will be.
I think with your commitment, and I think it's really important, that's why I acknowledge all of you on this call and all of you on this panel, that you are here because of your commitment. And having that will to change, having that high level commitment is really important. And for those of you that are interested, you will also see in the chat box, there is a link to a couple of blogs where you're able to see some of the Kenya stories in blog form that you can read more slowly on how they dealt with the professional bodies and how they dealt with some of the challenges that they faced. Marcella, let me come back to you now and say, if we think about what you've done in Jamaica, what would you say to other governments they could learn from your experience? We often say to people, you learn the hard way, but having sessions like this to do country sharing is to help countries have ideas that can help them make that journey quicker, like Melika made it happen so quickly. What are your top tips to other governments?
Okay, the first one is that commitment is necessary at the highest level. In Jamaica, for example, we have the Honorable Minister of Health and Wellness, so it's Dr. the Honorable Christopher Tufton, and he's an advocate for infant and young child feeding. And this is seen as Jamaica is signatory to international targets. Also, infant and young child feeding is included in all our national plans, the development plans, and also in our sector plans. And even within the Ministry of Health, as it relates to our regional health authorities, we have service level agreements that with targets that they have to meet related to infant and young child feeding. So the bottom line is that commitment is needed at the highest level. Also, it's important to utilize the consultative process throughout the development of the policy, and this will help to have a mix of policy actions. For Jamaica, we had consultations with a number of group or organizations, including development partners, NGOs, professional associations, advocacy groups, distributors of infant formulas, and key government ministries, departments, and agencies, and the general public. An integrated approach is necessary, and it's important to integrate infant and young child feeding support and promotion in healthcare services, education programs, community development initiatives, workplace policies, and practices, and partnership is important as well, and partnership with our international partners such as WHO, UNICEF, IDB, World Bank, ministries and agencies, professional groups, and other organizations, and support for the policy in the international community that push forward the agenda significantly. Because we had support from WHO and WHO, UNICEF, Inter-American Development Bank, and World Bank. And these organizations assisted us technically and financially across the process, and also
I think you've given
as
us
it relates
lots
to
of
the
food for
implementation
thought, so
of activities related to infant
I'm
and
going
young
to
child
stop you
feeding.
there, Marcella, because you've given us lots of food for
Right.
thought. And before I go to Kenya for some tips, Milika, I'm coming back to you for a minute, because I want to hear about high-level commitment. We heard from Dr. Kamsing how they had very high-level political will. Marcello said the same, and you might have said it, but just tell us how high-level political will you had before I come to you, Veronica, for your tips to governments.
I will repeat. Glad to hear that question first. I will repeat. We found a national committee for breastfeeding. And in the top of the breastfeeding committee is my Ministry of Health, and every expert in Montenegro for all that. So we will supervising everything we do in Montenegro and everything we did. And this commitment, obligation of this commitment is to provide the best care for newborn and for the mother, and to provide good outcome of the breastfeeding for the newborn babies. So this commitment is from the Ministry of Health, and it will supervising everything we do in Montenegro. And this
Fantastic.
is our high-level policy.
Thank you for repeating that. Really, your champion is the Ministry of Health. Veronica, you also might want to repeat on your high-level champions, but then I want you to give us some of the tips that you would give the other countries joining our call today. We have over 150 people, so what are your tips to them going forward?
Thank you very much, Jane. For one, I think what I would urge the other country is first have a clear understanding of the legislative process in your country, so that you are able to know who to involve, and you are able to troubleshoot in the process. Yeah, because you can be taken aback. You know, like recently when we were doing the BMS, the breast milk substitute regulation. And we presented to the committee of the House. We were told you have to do the regulatory impact assessment, and already we have drafted the regulation. So it's good to be very clear on the legal legislation so that you are not taken in by surprise. I had mentioned about, from the word go, get legal advice, get real legal drafters, because sometimes you can, even the industry can penetrate and be able to influence the drafters you are having and put up a legislation that will not help your country. And of course, documenting every process, so that once, let's say like stakeholder engagement, you're asked, did you do stakeholder consultation? You have the list of the people, you have the workshop report, and so you are prepared for any question, even if it goes to the National Assembly. And of course, getting a real champion. Like for us already in the Parliament, we have a nutrition advocacy member of Parliament.
Fantastic.
And we also have right now the chair of the Health Committee of the Parliament. She's also a very great supporter of breastfeeding. So we are able to use these, pro legislators to push our cause, and that's very important. Our cabinet secretary is also a champion, and he has been able to withstand storm of the many submission from the industry, from the World Trade Organization member states, and he has stood firm. So, you require somebody, and why has he stood firm? Because you present him with the facts and why we need to do this.
Fantastic. Thank you, Veronica. Champions, champions, champions. Dr. Kamseng, I'm going to let you close our panel with you sharing what advice would you give to countries that want to do what you have achieved in Lao PDR? What top advice can you give?
Firstly, I think there's the strong leadership of the high level is very important. There's make everything easier, and as my country is luckily that we follow the global target. No? Therefore, there are the establishment of the National Nutrition Committee chaired by the Deputy Prime Minister. So therefore, strong leadership from the very high level to the grassroots level is a very important and facilitate on nutrition work, including the protection, promotion, and support of breastfeeding. And also the financial support, like a fiscal year budget, yeah, is easier for negotiate or for defense in the National Assembly. And then also we have the strong partnership within Life Ministry and within the own ministry, and amongst the development partner, we involve on multi-stakeholder in implementing the National Nutrition Strategy as well as the National Nutrition Plan of Action for nutrition. Yeah. So
thank you, Dr. Kamseng.
Yeah. Okay, thank you.
I think you will all agree that you will have left with some really good tips from these wonderful countries. To Veronica from Kenya, Asante Sana, to Dr. Kamseng, thank you so much for having been with us. To Jamaica, to Marcella, thank you. To Milika, thank you so much for sharing with us the importance of being strong, having champions, having the right partners, not the wrong ones, and really setting your focus and staying the path. So thank you to the four of you for being with me on the panel. I've loved talking to you, and I look forward to hearing what your countries are going to be saying at the Nutrition for Growth Summit. Let's go to a quick Mentimeter again before we go to our next speakers. We're going to have not long for this one, so please look, the Mentimeter is in the chat box. What country action that you just learnt about do you hope to implement or adapt for your own country? Was there a country action you heard about from our colleagues that you would like to implement and adapt for your own country? And I definitely see that the Kenyan example has been powerful, and that you really are hoping to enact the law, the code, make sure that it's fully enacted and then implemented in your country. So identifying champions has also come up on the Mentimeter, and that we've heard is being very critical. Champions at all levels was something that we definitely heard from our colleagues. And we're seeing that again, the champions coming up. Scaling up the training of your breastfeeding counselors so that they really are strong and know what's right. Having the right partners on board. I love what we're seeing here. So thank you to those of you who've entered it. I know perhaps some of you were still thinking about it, but you can think about it and then apply it in your own country. So let's move on to our next presentation if we can. And I think our next presenter probably needs no introduction to all of you, because I think most people know Larry Grunner Storm, who's the unit head of the Food and Nutrition Action in Health Systems at the WHO. I think many of us just call him Larry from the WHO. Larry, the floor is yours as you're going to share with us why the time for bold commitments is right now. Over to you, Larry.
Thank you, Jane, and hello, everyone. I just want to start off by thanking our wonderful speakers so far of setting the stage for why this is such an important issue and the key commitments that we need to make to move forward on breastfeeding, and really to our country speakers. The words I kept hearing in the chat and in the discussion here was powerful and inspiring. It is so wonderful to see action around the globe on enacting the code, on encouraging healthcare providers, on educating them, on addressing workplace issues. So many commitments that really are moving forward on this issue. I really want to speak to all of us to call us to action. Now is the time that we need to make strong commitments for N4G. Next slide, please. So I want to walk through a few of the arguments on why we need to make bold actions now. First of all, it's too important not to. We can't wait on this. We heard at the beginning of the talk from Maza and Miski about the number of deaths every year that occur from the lack of breastfeeding. This was documented in a scientific series in The Lancet a few years ago. It's a big number. And yet we sometimes get just lost in these big numbers because, well, who knows about the millions and the billions and the hundreds of thousands? How do we understand these numbers? And we did some calculations. It turns out this is about 1 in 6 child deaths are due to lack of breastfeeding. We have so many interventions that we need to do for child survival. This one has to be part of the package when it is 1 in 6. We heard statistics about how breastfeeding is preventing diarrheal diseases and respiratory infections. These are the things that happen during infancy while the babies are being breastfed. And we know that we need to protect those infants, but it doesn't stop there. And I think a key message that has been increasingly coming out of the science is that breastfeeding has long-term impacts on those babies. It reduces childhood obesity. And this is important in high-income countries that say, we don't have a lot of infectious disease. We're looking at other issues. Why do we need to care about breastfeeding? This is an epidemic that they're very concerned about. We need to be focused on this. It improves the intelligence of the children, improves adult earnings. Later on in life, 20 years down the road, we're seeing the impacts of breastfeeding on those babies. And we know that the mothers themselves are protected against maternal cancers and diabetes. How can we not be protecting breastfeeding when it is so important for the health of our populations in so many different dimensions? Next slide, please. We also know that it saves money. When we translate some of that into the economic costs of not breastfeeding, it's huge. You heard from Miski presenting earlier that every dollar invested in breastfeeding protection, promotion, and support could save $35 in economic returns. How can we not be investing in breastfeeding when we see that? She also quoted the number of $300 billion in economic productivity that is lost every year because of the lack of breastfeeding. That is 0.5% of our global domestic product. That is a huge, huge number. That this one act of what is happening with the care of our babies is a huge part of our global economy. We have to invest in it. We actually have tools now available on the Global Breastfeeding Collective website that you can go into actually calculating the costs for individual countries. It's not just at a global level, but we can say, what does this mean for different countries? And that tool actually walks through how do you actually get these figures at your country so that you can use these numbers. Next slide, please. What we also need to recognize is that this is not an intractable problem. So often in child survival or in nutrition, we work slowly. We recognize that we're not going to solve nutrition problems in just 1 year. We're not going to turn things around. Yes, we're making progress in the right direction, but things plod along little by little. When we look at breastfeeding rates, it is remarkable how some countries have been able to make dramatic improvements in a fairly short period of time. In a report that was just released by the UNICEF a few weeks ago, where they released their new statistics on infant and young child feeding, There are a number of countries within those databases that have shown sustained progress over the last decade in improving their exclusive breastfeeding, oftentimes doubling the amount of the number of babies that are exclusively breastfed. And that's tracking over time, survey by survey. So it's not just random fluctuations. These are ones that are really making huge differences, and they occur in all continents, whether it's Africa or Europe or Asia or Latin America. We do know how to make a difference here. Next slide, please. And we also know what we need to do. This was laid out in the commitments that are really based on the 7 policy asks of the Global Breastfeeding Collective. I've highlighted them here to improve access to skilled breastfeeding, counseling, to encourage community networks, implement the 10 steps, increase our funding, implement the code, strengthen our monitoring systems, have family leave and workplace. We're not going to go into those details again, but we do know these things work. They've been proven throughout the world, and we just need to enact them. Next slide, please. Not only do we know what we need to do, we also have the tools on how to do it. So as we look at each of these, when we look at skilled breastfeeding counseling, there are tools available from WHO and UNICEF on how to implement programs at the country level to counsel women. How do we actually build those programs to make sure that they are adequately financed, that we have a staff of people who can provide the counseling, we can coordinate them and do the supervision for those programs. We have a guideline on what services actually need to be provided. This is science-based through WHO's scientific evidence processes that really document what do we mean when we talk about counseling? How often does it need to occur? Who can do that? What is the content of that counseling? And we have courses. WHO has just released an infant and young child feeding counseling course, an integrated course that updates the materials that have been available for a number of years. And it is now newly available for how we can actually bring people up to speed on how to do skilled breastfeeding counseling. These are all accessible on the Global Breastfeeding Collective website through the toolkit. Next slide, please. We also have tools on the implementation of the 10 steps. We have guidance on how the 10 steps can be operated as a program and a competency verification toolkit to ensure that healthcare providers know what to do, how to support breastfeeding in that first 48 hours, 24 hours, whatever the hospital stay is or the maternity facility stay is, depending on where those babies are born. How do we ensure that they actually have the skills that they need? We now have tools for testing them. We have a course for training people at the maternity facility level on how to implement the 10 steps. We have guidance on how to apply it for the NICU unit or the sick and small newborn units, because we know that these policies are not just for healthy babies, they're also for those preterm babies and the low birth weight babies as well. And how do we actually apply it in those contexts? We now have guidance on how to do that. And we have posters, easy communication materials that can be used to educate people and make sure that they're always reminded of what they need to be doing in these 10 steps. Next slide. We also have tools available about family leave and workplace policies, guidance on what support for breastfeeding looks like in the workplace. We have advocacy documents on how to advocate for maternity leave legislation. We have analysis of the kinds of leave legislation that already exists so that we understand where the gaps are and also where we need to fill those gaps. And documentation of the family-friendly policies beyond maternity leave. What do we do when women actually do need to go back to work? And how do we make sure that we're accommodating her in an appropriate fashion so that she can continue breastfeeding her baby as those babies get older and she has to work? Next slide, please. We also have tools on the site about the implementation of the code. There's a course available for training healthcare providers and other workers in public health on what is the code and how do we understand it. We have tools about understanding what the current legislative status is of the code so that countries can see how do they need to improve their legislation. They know that they want it to be stronger, but what are the most important areas of that? And what kind of language works well to protect babies and what language is a little bit too weak that leaves too many loopholes? And so we've documented the countries, what their actions have been on legislating the code, but also the details of where the gaps are and where they need to improve. We have tools for monitoring the code, the Netcode toolkit for ongoing monitoring, as well as for assessing just the status of what kinds of violations are happening to the code. And those are easy walkthrough tools of how they can actually implement this at the country level. We have frequently asked questions documents for the general understanding of the code, as well as one that is really targeted to the roles and responsibilities of healthcare workers under the code. So we can educate people what their responsibilities are, what can they do to implement this. Next slide, please. And we have tools for strengthening monitoring systems. Earlier this year, WHO and UNICEF published new indicators for assessing infant and young child feeding practices with great detail on how to ask the questions, how to analyze data, how to tailor the questions into the local context to really understand what is going on with breastfeeding and complementary feeding. Those indicators are available now. We also have tools on how we assess what countries are doing in terms of their policies for implementing the various commitments that we've been talking about here. So the Global Breastfeeding Collective's scorecard that we launch each year is available now as of today on the Global Breastfeeding Collective website. So we're using this event as kind of a launch event to make that available to people. And we have a new document describing that Global Breastfeeding Scorecard for 2021. And this year's document really focuses in much more on the bold national actions that we need to make for the N4G, but also puts it into the context of the COVID pandemic and beyond. Next slide, please. And the final argument about the commitment to bold actions is that now is the time. And this has really been highlighted by COVID. Every year we can say, now is the time. We need to take action. And it certainly is, all those same arguments are there, and N4G highlights it for us. But COVID has really shown a spotlight on this. We've seen so many challenges to breastfeeding because of the lack of ongoing support. Hospitals are separating mothers and babies because they're saying, oh, we might be seeing transmission here. And if we're going to have social distancing, otherwise, let's protect the babies. That is counter to WHO policy and counter to UNICEF policy. We've seen healthcare staff being diverted from the breastfeeding counseling services that they normally would provide, and now are not providing those services. And so women are suffering from not getting the counseling that they need. We know mother-to-mother support groups. Peer counseling has been suspended because of social distancing. And we've seen industry taking advantage of the COVID epidemic to market their supplies. They've been giving out free supplies in communities saying, in case you need it during these tough times, companies positioning themselves as COVID experts. We're going to help you understand your questions about COVID, as if a manufacturer of formula is the entity that we should trust for COVID. They've been advising against breastfeeding for women who are COVID positive, in contrast to the WHO recommendations. And we've seen our breastfeeding data collection systems have been suspended because of the difficulties of collecting data during this time. So all of the things that we've been talking about, the ways that we need to support breastfeeding have become more difficult. It makes them more urgent for us to really address this with stronger policies and stronger programs. Next slide, please. So just to summarize, we need to take bold actions at N4G. I call on you as countries, whether you are presenting today or listening to the presenters or your other stakeholders, we need to take these bold actions on breastfeeding. Now is the time. Please step up, use this opportunity to get on the global stage to talk about the importance of breastfeeding and the importance of protecting, promoting, and supporting it. Thank you very much. Final slide.
Thank you so much, Larry. And what a fabulous final slide picture to remind us of how early initiation, exclusive breastfeeding to 6 months, and continued breastfeeding onwards is so critical. So I hope we've inspired you that the time is now. And we're going to go to a last Mentimeter. We'll finish still on time to ask you to share with us. You've heard about lots of tools that are available on the Global Breastfeeding Collective website. The link to the website is in the chat box. But let's hear from you. What tools do you feel you need to galvanize support for a breastfeeding-related commitment in your country? What do you think would help you most as an advocate, as someone who joined this call because you have an interest in the topic, please go to Mentimeter again. The link is back in the chat box, or go to Mentimeter. The code is 16128725. And we would love to hear from you what you would need to galvanize support to make sure that a commitment was made by your country. So I'm going to give you a minute or two to think about it. We can't promise we're going to give you all of it. I see the first person put they want funding. That's something countries really have to look for and find. We see a social media kit, visual advocacy briefs. So please keep writing. The economic effect of not breastfeeding, wonderful resource available on the Global Breastfeeding Collective for that. Ideas for campaigns, a monitoring and evaluation tool. There's some of those available, so we need to talk more about some of the things that are available. So please keep writing them there, because we are going to make sure that we save this list and that we look at it and we make sure that we see where we can reach out to you. So let me give you another minute in case anybody else would still like to write the kind of tools, and I specify particularly tools that you feel would help you in your work. And as we then come to the close of the session, I know that not all the questions were answered in the session, but we will make sure that we keep those questions and we will find ways of communicating with people around them. But I also would like to remind each of you that you can always call on your WHO country colleagues or your UNICEF country colleagues at your country level to be able to support you, give you advice, or to refer your questions on to anyone in the global organizations that might be able to help them. So I think there is nothing further than to say thank you so much to all our amazing presenters. Thank you to all our behind the scenes hard workers. There have been many people that have been working long nights, and I can attest that they worked all weekend as well to make sure the presentations were up, the resources available. And to each one of you, I want to say that there is a very good saying that well done is better than well said. The time for talk is over. Now we see commitments at the Nutrition for Growth Summit around protection, promotion, and support of breastfeeding. And then we need to see those commitments turned into real actions, enforced, monitored, measured at the country level. If we are ultimately to do what I think makes many of us wake up for in the morning, and that is to make the lives of infants and young children around the world so much better, so that countries can have a brighter, greater future. And right at the foundation of that is protection, promotion, and support of breastfeeding. And each one of us needs to advocate where we stand for actions to do that. So we thank you all for joining us. We thank you to our interpreters for interpreting for us. And as you go forward to make these words become actions, please go safely, stay safe, and thank you for joining all of us on behalf of UNICEF and the WHO. Goodbye, everybody.
Goodbye, Chen. Thank you very
Bye-bye,
much.
Dr. Kamsing.
Bye-bye.
Bye, Larry. Goodbye, Veronica. Thank you for being with
Bye-bye.
us.
Thank you, everybody. Wonderful presentations.
Bye-bye.
Bye-bye, Milika. Thank you.